Ladayza Mannie, and I'm going to be testing her lumbar rotation in the active range of motion. So first I'm going to ask for her permission. Do I have permission to perform this test on you?
Yes, you do.
Okay, thank you. So now I'm going to have her step in front of the table. Now please place your back in front of the camera. Thank you. Now cross your arms like this and rotate towards your right as far as you can. Now rotate towards your left. Thank you. When performing this test, we're seeing how far her active range of motion is bilaterally. Now that we have determined that the infield is firm in our active range of motion test, I'm going to move on to goniometry. Now I'm going to have my patient sit on the table, and then I'm going to grab my goniometer. I'm going to align the fulcrum with the center of her head, the moving arm with her acromion process, and the stationary arm with the anterior iliac spine. But first I'm going to ask my patient to rotate as far as she can on her right side. For this, I got 55. Now that we have determined her right side, we're going to move on and test her left side. So can you now rotate as far as you can on your left side? I'm going to again align my fulcrum with the center of her head, my moving arm with the acromion process, and my stationary arm with the anterior superior iliac spine. For this one, I got 42. The normal range for lumbar rotation is between 30 and 35. Now I'm going to be performing passive range of motion on the passive anterior glide for sacral counternutation. Okay, so I'm going to first add a pillow right here and have my patient lay on her side. Now I'm going to have her place her chest onto the table and relax her hand. With the bottom leg, I'm going to put it on my hip, and with the other leg, I'm going to have her extended. Now I'm going to interlock my hands and place my elbow on the PSIS. And I'm going to perform a thrust movement. Now I'm going to perform it bilaterally. Now that my patient is in this position, I'm going to have her place her chest on the table. Now I'm going to grab the bottom leg and put it on my hip again and have her extend her leg. And I'm going to put my elbow on her PSIS. I'm going to perform a thrust-like movement. Impaired joint mobility or infill may suggest a dysfunction. Next, we're going to perform the grade 5 manual muscle test of hip internal rotation. So to start this, I'm going to have my patient sit on the table with her knees flexed. In order to get a better reading, I'm going to add a rolled towel underneath her femur. For a grade 5 test, we're going to start off with the most resistance that we can. So, while I'm pushing out, you're going to try to push in. Ready? She was able to do this. This means that she passed a grade 5 manual muscle test. Now I'm going to move to her left side and test bilaterally. Now, while I'm applying resistance outwards, you apply a resistance inwards. she was also unable to break it. The muscles involved in this is the gluteus minimus and the gluteus medius. Now I'm going to perform special tests. For the first special test, I'm going to perform the passive lumbar extension test. The sensitivity for this study was 84 and the specificity was 90. This test is used to rule out a radiographic lumbar spinal instability. So now I'm going to start and have my patient lay prone on the table with her arms relaxed to her side. I'm going to come to the edge of the table and lift her legs off the table, like this. A positive test is indicated if the patient complains of pain in the lumbar region of their spine, especially if the pain is there when I lift her from the table, and then when I return her back to the table, the pain goes away. The next special test that I'm going to perform is the posterior shear test. For this test, I'm going to have my patient lay supine on the table. The sensitivity for this test is 88 and the specificity is 69. This test was used to rule in SI joint pain. So to perform this test, I'm going to have my patient flex her knee at 90 degrees. Now that her knee is flexed, I'm going to place my other hand under her SI joint. While having her knee elevated, I'm going to start pushing and giving thrusts. If the patient complains of pain in the SI joint, then this indicates that she has a positive test. Now I'm going to perform the test bilaterally. Can you please flex your knee for me again? Do you have any pain?
No, I do not.
Then she is negative for this test. Now I'm going to move on to palpations. For my first palpation, I'm going to do the L3 transverse process. To start, I'm going to have my patient laying in the prone position like she is. I'm going to first feel for her iliac crest and move straight in. I'm not going to assume that I'm on L3. So in order to test if I am, I'm going to feel each spinous process till I get to S1. Now that I'm at S1, I'm going to go upwards, counting down from L5 to L3. L5, L4, L3. Now that I am at her L3 spinous process, I'm going to go superiorly and feel for her transverse process. Lastly, I'm going to palpate the gluteus medius. To start this, I'm going to have my patient lay in the supine position like she already is. So I'm going to place my hand on the posterior part of her hip, and then I'm going to place my other hand on the lateral aspect of her knee. Now I'm going to ask her to abduct for me, which is go away. When she's doing this, I can feel the muscle contracting in and out. Next, I'm going to perform it bilaterally and do the other side. I'm again going to grab the posterior part of her hip and the lateral aspect of her knee and ask her to abduct.